because now this is important. When your testosterone levels, the adrenals make testosterone in women and the ovaries make testosterone in women. And there's this interesting thing during the perimenopause that nobody talks about, which is that the center of the ovary, the medulla, begins to hypertrophy. You get more and more. So healthy women make more testosterone at midlife and less estrogen. And if you have enough testosterone, which is sort of the hormone of desire, the hormone of life force, if you have enough of that, then your body will take that and make the necessary estrogen and progesterone. So, you know, I know that the conventional approach is, you know, Dr. Prudence Hall was the big hormone doctor in California that Oprah was going to, and she has had women on the Wiley protocol. This was Suzanne Summers' approach. Get your hormones at the level of a 21-year-old. And Suzanne Summers and the Wiley protocol was cycle your hormones so that you have a period every month. Well, who wants a period every month in their 80s? Most women don't. And the Wiley protocol gives you a period every month. Suzanne Summers didn't tell the world that she's had a hysterectomy, so she doesn't get a period every month. So that's something that women should know. We all, okay, here's the thing. We all want to die young, as late as possible. And what I want women to know, and why I wrote Goddesses Never Age, was that I wanted them to know that what we call aging in our culture is largely preventable. And a tremendous amount has to do with the way you think, with the cultural portals. You know, so age 35 for a woman who hasn't had a baby yet, that's a cultural portal where she's been taught by the culture that her eggs are all going to get old now and that fertility falls off like that. It doesn't. For a large population, yes. But I've seen women in their 40s who are physiologically, biologically older than many women in their 60s. And the data, by the way, from Gina Ogden out of Harvard, who's a PhD in human sexuality, points out that it is women in their 60s and 70s who are having the best sex of their lives. And nobody hears about this. And so if you need additional help, there's additional help available. No woman should suffer from what's called, I hate the terms we use in medicine, atrophic vaginitis. What that means is the lining of your uterus, which is very sensitive to estrogen, isn't getting the estrogen that it needs. So there are creams that you can use for that. I worked for years to create a vaginal gel that has Pararia mirifica that works really well as non-prescription. However, regular sexual expression with a partner or alone keeps that area in good working order by bringing the blood into that. We're sexual creatures our entire lives. And there's nothing about turning 40, turning 50, turning 60, turning 70 that changes that. But we're taught in our culture that things are supposed to stop working.